In the complex world of healthcare, making informed decisions about where to allocate resources is crucial. Cost-effectiveness analysis, or CEA, has emerged as a vital tool for policymakers to ensure we get the most out of every healthcare dollar spent. Simply put, CEA helps us understand the value we get for the money we invest in different health interventions. By comparing the costs and health benefits of various programs, CEA provides crucial insights for prioritizing treatments and preventive measures. This analysis helps policymakers make informed decisions, ensuring that limited resources are directed towards the most impactful healthcare strategies. CEA considers not just the immediate expenses, but also the long-term impact on health outcomes. This means factoring in things like prevented illnesses, reduced hospitalizations, and improved quality of life. By quantifying these benefits in relation to the costs, CEA provides a clear picture of which interventions offer the best return on investment for society. This approach ensures that healthcare policies are not just about spending money, but about spending it wisely to achieve the greatest possible health gains for the population. The beauty of CEA lies in its ability to compare vastly different health interventions on a common scale. Whether it's evaluating the cost-effectiveness of a new drug, public health campaign, or a screening program, CEA provides a standardized framework for comparison. This allows policymakers to move beyond subjective judgments and make evidence-based decisions about resource allocation. In an era of rising healthcare costs and evolving health challenges, CEA serves as a compass guiding policymakers towards strategies that deliver the most health benefits for the resources invested. By embracing CEA, we move towards a healthcare system that is not only financially sustainable, but also delivers the best possible health outcomes for all. This approach ensures that every dollar spent on healthcare contributes to a healthier and more productive society. As we face new health challenges, from emerging infectious diseases to the growing burden of chronic illnesses, the role of CEA in shaping effective and sustainable healthcare policies will only become more critical. The COVID-19 pandemic presented an unprecedented challenge to healthcare systems worldwide, demanding rapid and efficient allocation of resources. In the United States, cities like New York and Los Angeles turned to CEA to guide their vaccination strategies, ensuring that every dose administered had the maximum impact on curbing the spread of the virus. In the early days of the pandemic, with vaccine supplies limited, the question of who should be prioritized for vaccination was paramount. Should we focus on the elderly, who were most vulnerable to severe illness? Or should essential workers who interacted with the public daily be given precedence? CEA provided crucial data to inform these decisions, weighing the risks and benefits of different vaccination strategies. By modeling the spread of the virus and the impact of vaccination on different population groups, CEA revealed that prioritizing older adults and individuals with underlying health conditions would save the most lives. This data-driven approach allowed cities like New York and Los Angeles to allocate their limited vaccine supplies strategically, ensuring that those at highest risk of severe illness and death were protected first. As vaccine supplies increased, CEA continued to inform the rollout, guiding decisions about expanding eligibility to other groups and optimizing vaccination efforts for maximum coverage. The use of CEA in shaping vaccination strategies during the COVID-19 pandemic highlights its value in responding to public health emergencies. By providing real-time data and evidence-based recommendations, CEA empowered policymakers to make agile and informed decisions that ultimately saved lives and mitigated the impact of the pandemic. Chlamydia, a common sexually transmitted infection, often presents no symptoms, but can have serious long-term health consequences, particularly for women. In Atlanta, a city with a high prevalence of chlamydia, policymakers turned to CEA to determine the most cost-effective approach to screening and treatment. This analysis focused on identifying high-risk populations and tailoring screening programs for maximum impact. Traditional chlamydia screening often involved testing all individuals within a certain age range, regardless of their individual risk factors. However, CEA revealed that this approach was not the most efficient use of resources. By analyzing data on chlamydia prevalence, transmission patterns, and the cost-effectiveness of different screening strategies, researchers discovered that targeting screening efforts towards high-risk women would be far more impactful. This led to the implementation of targeted screening programs in Atlanta, focusing on women under the age of 25, those with new or multiple sexual partners, and individuals with a history of sexually transmitted infections. By concentrating resources on these higher-risk groups, Atlanta was able to significantly increase the detection and treatment of chlamydia infections, preventing long-term health complications and reducing the spread of the disease. The Atlanta experience demonstrates the power of CEA in shaping public health interventions. By shifting from a one-size-fits-all approach to a more targeted and data-driven strategy, policymakers were able to improve the health of their communities while using resources more effectively. This example highlights the importance of using CEA to tailor public health programs to the specific needs and risks of different populations.